Meanwhile, Taiwan has reported 7 more imported COVID cases on Wednesday. All 7 had presented a negative COVID test result upon entering Taiwan.
So far this month, 32 of the 40 Indonesian migrant workers diagnosed COVID positive in Taiwan had entered with a proof of negative test result. As questions loom over the reliability of Indonesia's testing system, Taiwan has announced that its entry ban on Indonesian migrant workers will be extended indefinitely.
All 7 cases reported on Wednesday had entered Taiwan with proof of a negative COVID test. With so many people testing positive after arriving, officials are increasingly questioning the proof being furnished.
In the US and in Europe, there are issues with the timing and with the test reagents. In Indonesia, the rate of positives is really high. Of 132 cases, 76 had presented proof of a negative result. Whether you've got proof of a negative test or not, it doesn't seem to matter.
Back in October, 2 out of 11 Indonesian migrant workers diagnosed with COVID had provided proof of a negative test upon entry. In November, the rate was 42 out of 81. So far in December, it's been 32 out of 40. As questions loom over the reliability of Indonesia's tests, the Taiwan government has offered the country technical assistance and reagents. So far, Indonesia has not accepted.
They don't think they're doing anything wrong. They think they're doing very well. That's how it is. We think there's something off with the negative test reports. That's something we have less of a consensus over.
With cases from Indonesia rising, the CECC has extended its 2-week entry ban on Indonesian migrant workers. Health authorities say migrant caregivers will be included in the government's COVID vaccination program once it begins. With COVID vaccines rolling out in some parts of the world, new rumors have cropped up online. According to one post making the rounds, vaccines can improve one's own immune response, but it cannot prevent the vaccinated person from becoming a carrier of the disease who can spread it to others. On Wednesday, a health official said this was true only in a minority of cases.
The vaccine doesn't offer protection in 100% of cases, so after getting the shot, there will be a minority of people who will be vulnerable to an infection and become a carrier. In that case, there is, of course, the chance that they will infect others.
Health Minister Chen emphasized that the vaccine only lowers one's likelihood of getting infected. He said the CECC would monitor other countries closely as their vaccination programs unfold. Vaccines aren't a silver bullet, he said, stressing that following public health rules will still be vital in the future.